Good morning, gang. Happy Thursday morning. All right, we're going to talk about something this morning that's kind of appropriate considering I have a doctor's appointment this morning. So chances are there won't be a noon video today. I want to talk about the fact that here we are coming into open enrollment season. Okay, whether it's Medicare, whether it's your company health plan, whatever it would be, it's time to take a look at your medical coverage for 2024. I'm going to tell you one thing. Expect it to get more expensive and get less productive. Let's put it that way. It's no surprise we have a huge medical shortage in the United States at this point. Why? Oh, I don't know. We've just added a few million people to the ranks of the uninsured that have come into the country that need medical attention. And this all takes away from the services that you get and adds to the cost. Now, y'all know the laws that are in the United States that an emergency room cannot turn away somebody regardless of their ability to pay. Okay. So Juan and Maria, when they're coming across the border, they want to go see a doctor. They don't have a primary care physician. They don't have insurance. So they've got the sniffles. They go to the ER. The ER has to take care of them, and the bill never gets paid. Okay, so the hospitals wind up losing money. The hospitals have to get money somewhere, so they got to stay open. That's helpful, and so they raise the rates on services provided. I mean, I'll give you this, and it's now been a year since I've had to do this, but me going to the local ER, there's a reason for me doing this. My doctor is an hour and a half away. That's the loveliness of the VA, that how close my doctor is. I get poison ivy. The VA clinic is closed on the weekend. When you out working in the yard on the weekends, okay. I go into the ER to get a prednisone shot and a prescription for pills. That's it, okay. One shot, not expensive, and a prescription that I got to pay for. That's a $670 bill, okay. And of course, eventually I send it off and the VA pays it. It's my insurance. But that's the cost, how crazy it is. And stuff like that is going up. Let's take a look at a few things of how this is affecting us. The medical system in New York City right now is strained under the weight of all the illegals coming in, okay? Just the sheer number of people going to the hospital are taking doctors away from insured patients, are taking beds away from other people. I mean, just this year, they have the New York hospital system, okay, in the 5 boroughs, has had 30,000 visits from undocumented illegals, okay? That's according to the New York City Health Department. Also said there's about 300 anchor babies that have been born in the New York City hospital system. Somebody's got to pay for all that. You know, chances are a lot of us have had children, okay, or know of somebody who knows what the bills are. It's a 5-figure bill that usually comes in when you have a kid, all right? So, okay, we're talking about 300 people, 300 times 10,000, start doing the math here. We're talking millions of dollars. But that's not the only thing. Well, not only do these illegals need treatment, but they need medicine, okay? Hey, they're coming over. I mean, what are we seeing? An influx of tuberculosis coming into the United States. God knows how many other things. I mean, if you caught this one, this was kind of interesting yesterday. Biden has now reinstated the policy for contact tracing. If you leave the United States, say you go on vacation, fly to Europe or go to Canada, okay? go to Acapulco. I don't care. If you leave the United States, you have to do the contact tracing thing. Who have you been around in the last 72 hours, yada, da, da, da. And we want names, addresses, phone numbers, all this sort of stuff. And that's required for you to get on an airplane and regain access to the United States to make sure that you don't have the latest variant. Of course, if you don't want to fly, just walk across the southern border. They don't care. You don't have to have any contact tracing for that whatsoever. Logic, not in this administration. Okay. But so let's talk about the next one. Let's talk about drug shortages. Okay. Antibiotics. Okay. Carboplatin, which is a type of amoxicillin. We're short on that. Okay. Cancer medications like cisplatin, we're short on that. Okay. Diabetes treatments, Ozempic, Mounjaro, Trulicity. Okay. We're short on that. ADHD medicine, Adderall, we're short on that. Life-saving drugs, we don't have enough of. Okay? I mean, you have cancer, you're on medicine that keeps you alive. You have diabetes, yeah, you know what? Ozempic or Trulicity or whatever keeps you alive. Those are important. But we don't have enough. Why? Because, well, there's multiple reasons to this, but one of them is the amount of people getting it is supply and demand, causing a shortage. And then when you have the topper of the amount of people who aren't paying for it, causes a shortage, okay? Because now the drug companies, and I know I'm not trying to be a pro-pharma guy here, if they're not getting paid for their drugs, they can't make any more of it. We start getting into a scenario where healthcare is going to be too expensive for people. And again, we'll add this all in. I've talked about this, a few months back about rural hospitals closing. How much longer is that going to take? We're going to start closing the rural hospitals. They're going to focus. All the drugs are being sent to the city hospitals. You want medical attention? You need to go into the city. You want electricity? You need to go into the city. You want food? You need to go into the city. You're seeing a pattern here, okay? This is what's going on. One of y'all sent me an email the other day talking about cancer medication that you needed. I won't mention the person, obviously, for HIPAA reasons, and said that they couldn't get the medicine at their local pharmacy, that they were out. So they spent the day calling around all the other pharmacies 20, 30, 40, 50 miles away to see who had it. And was told by one pharmacy, yes, they had it, but reserved it only for people that lived in their county. There's a little bit of a medical quandary I have with this one. Okay, is this a pharmacist who's withholding care based on where somebody lives? We're talking a violation of Hippocratic Oath. We're talking a discriminatory violation. Personally, if it was me, I'd be having a conversation with law enforcement about the response that pharmacy had, okay? Because a pharmacist withholding a doctor's ordered medical treatment, yeah, we got a problem with that one. But what I'm saying is this: when you get your open enrollment papers this year from your employer or your Medicare or whatever, however you get your insurance, take a look at what you're going to pay, what is being reduced in the amount of your care, and start shopping around. Because this is what they're trying to do. And too many people just have blinders on and don't consider the fact that this is all part of a big plan. Let's overwhelm the system, every one of them, the supply chain, the medical system, the legal system, the prison system, food stores, whatever it is, to the point where it's not profitable for entities to continue to do business. But we, the elites, will pick which ones can stay in business and which ones get shut down. Medical treatment is pretty important, especially as we get older. Okay, we don't spend, unless you're a daredevil or something like that. Chances are when you were younger, 20s, 30s, 40s, you didn't spend that much time in the doctor's office in the hospital, right? But as we get older, we have a tendency to see the doctor a little bit more. Eventually, just like everything else, things break down. Your body's no different. You know that. But remember, the elites, those 70 and 80-year-olds that are the Klaus Schwabs, the King Charles, the Bill Gates, all these guys that are running the World Economic Forum, who are on death's doorstep as is anyway, consider us to be useless eaters. And hey, they want depopulation after all anyway, right? So let's just get rid of the wisdom that has been garnered over the last 60, 70, 80 years, and let's just keep on the face of the earth all those people that have been indoctrinated for the last 20 or 30, and we'll get rid of those people that know what freedom is, and we'll just keep around the ones that embrace communism with both arms. Pinball out.